Okay, fantastic. So before I pass off the mic to our Vice Chair, Nashoba Temperley, good afternoon, everybody. It is June 20th. My name is Chicky Flowers. My pronouns are she, her, hers, and Shakanya. I am the Director of the Oregon Health Insurance Marketplace. Thank you for joining us for our consultation session with the Health Insurance Marketplace Advisory Committee. A couple of logistics items. If you would like to change your view up top in the top navigation, there's a view option. There are a couple of view options for standard, side-by-side speaker, side-by-side gallery, side-by-side multi-speaker. So please choose the best view that works for you so that you can see both the slides and maybe also see some of the folks who are sharing their screen, or rather sharing their video today. And if you would like translation, I believe interpretation, there in the bottom navigation next to the leave button, there is a more ellipsis. And there are options, there's an interpretation option there for you as well. So with that, I will pass the Zoom mic to Vice Chair Nashoba Temperley.
Hey, good afternoon, everybody. Hope you're doing well. Yes, this is Nashoba. Thanks for joining us today. Sorry for the technical hiccups as we kind of sometimes over on Teams, and glad that folks can join us over here on Zoom. So thanks to that. Thanks to everybody. Hopefully Lindsay will be joining us a little bit later, but I'm stepping in today to facilitate. So good to see everyone again. We could move to the next slide. So yeah, I was with that. Welcome everyone. Like I said, hopefully we can possibly move that over to Chicky to take a roll call before we kind of get into a little bit of our guidelines.
Sounds great, and will do. So for HIMAC members, when I call your name, if you can please come off mute real quick and let us know if you are here. This will also help us determine if we have quorum for today. And for those that are not in the HIMAC that are joining us here today as guests, we would really appreciate it if you can put your name and your company and your other affiliations with in the chat for us, so that we can also keep track of our attendance today. So thank you very much for doing that for us. So HIMAC members, Gladys Betwell.
Present.
Stacey Carmichael.
Present.
Charles Fisher. Ron Gallinat.
Present.
Paul Harmon.
Present.
Lindsay Hopper is not here yet, but maybe she'll be able to join us later. Shannon Lee. Kathleen Ork.
Present.
Claire Pierce-Robel.
Present.
Om Sakinai. Joanne Zumbrennen. And Vice Chair Nashoba Temperley, ICU. So with our 7 present members, we do have quorum. And we are ready to move on to meeting guidelines. So if you can please move us to the next slide, please, Don.
Great, thank you, everybody. So I'll move us through the agenda today, of course. Just want to remind everyone that, you know, here in the HIMAC, we're committed to a safe and inclusive meeting for all attendees. And we have differences, opinions, and different experiences, no bad or silly questions. And we seek the perspective of all, inviting each person to speak. If you have a question or like to comment, please raise your hand or put it in the chat. As you saw, we have some integrated Spanish interpretation. Please let us know if you need some help accessing. Please help by speaking at a moderate pace. Please be on camera as much as often as you're comfortable, and mute your speaker when not speaking. But thank you, everyone. The next slide, please. And as we saw before, transcribing and accessibility purposes, please state your name and posing a question or comment during the presentation, please. And we ask for members of the public to hold questions or comments until the public comment sessions. And there will be one in the middle and one at the end of the meeting. And please let us know. And please reach out to Chicky Flowers, our director here, if you need some other accommodations or comments. But thank you. Next slide, please. And in compliance with public meeting law, of course, as your name is called, please state your vote. Your vote will be logged. And of course, follow the link for the public meeting webpage, additional links. Thank you. Next slide, please. So we're looking, hopefully everyone within the HIMAC collective received a copy of the agenda and the full inclusion of the meeting and the minutes from previous session. Looking to.
Sorry, I was distracted or trying to get into my meeting and ask
no
for
problem. Hopefully everyone had a chance to review and looking to get a notion to pass the minutes from last sessions on April 17th.
Ron Gallanet, I move to approve the minutes.
Thanks, Ron. Do we have a second?
Kathleen Orrick, I second.
Thank you. Looks like we have approved from the members. I appreciate that. We can move to the next slide, please.
Nashoba, sorry, real quick, as a logistics requirement, we do need to record everyone's vote. So if you're in the HIMAC and if you vote to approve or not approve the meeting minutes, aside from those that made the motions, if you can put in your chat your vote for the minutes, that would be great for, that will help us out with the logging for the public law meetings requirement.
Of course, thank you. Give everyone just a second. Looks like we have about half of our members that have entered that into the chat. If you could please put into that, or if anyone else is having challenges, please let us know.
Nashoba, I think between the motion and the written approvals, we have approved minutes for April 17th.
Great, thank you, everybody. We can proceed to the next slide, please. We may have skipped over a slide. I'm not sure. There we go. I'll pass the mic over to Victor for the start of our presentation today and the marketplace assessment overview. Thank you.
Hi, everyone. Thanks. Good to see you all again. I'm Victor Garcia. He, him are my pronouns. Operations advisor and program liaison with the marketplace, and just going to go over the assessment process and just a little background before we jump into what we'll be talking about today, just as a context setter. So next slide, please, Dawn. So the assessment is what funds the marketplace. We're funded by an assessment on insurance companies offering qualified health plans, and we actually didn't put it on the slide, but also standalone dental plans through the marketplace. The assessment rate is set by Oregon administrative rules. So we set that in a rule and go through a rulemaking process every year to set that rate. And it is assessed as a per member per month amount. So it's a flat amount per person with a plan on the marketplace per month. And insurance ensures the companies currently pay a separate assessment for marketplace and also to the federal marketplace or healthcare.gov. The federal marketplace, also known as the FFM, is the place where Oregonians currently sign up and enroll for health insurance. Where the marketplace in Oregon, we administer the program in Oregon and also provide outreach, education, and are able to access data. So we're kind of the sort of state entity that's in charge of that. For that reason, there are two kind of separate assessments, and that assessment for the federal marketplace is paid separately by insurers, in addition to what the marketplace needs for its operating costs. Next slide, please. So when we go to set the assessment rates, the marketplace has maintained that per member per month. We also call it just PMPM structure since we've started that. That was actually before us. So coming over from when we initially started in 2015, health where on the contrary, healthcare.gov and most other states actually assess insurers based on a percent of the premium of the plans that are sold through the marketplace. We've always been of the opinion that it's better to just sort of try to get a little closer to our actual projected costs. So our method generally tracks a lot closer to what we think we're going to need as opposed to that sort of flat rate, which ends up sort of rising at the cost of the medical costs, the way insurance premiums do. So there are separate rates for medical and standalone dental plans. These rates are reviewed annually. First by marketplace staff and an economist that we either have on staff or that we engage, and we make adjustments and projections based on budget and what we think enrollment's going to be. And then we present that information to various stakeholders, including the Marketplace Advisory Committee, which is required by statute. And after that, that's used to build the foundation for the administrative rulemaking process, and we amend that rule after that advising portion takes place, and we get input and sign off from various parties by amending our rule there. We're 945-030-0030 for anyone into looking up OARs. That's where we are. We're all Chapter 945. And the marketplace statutes, again, require that those rates be reviewed by the HIMAC before we file that rule. So that's why we don't take that step first. We take this step first. And then after that asking and approval, then we go ahead and file. Next slide, please, Dawn. And that'll do it for that tee-up portion. Before we get into the assessment analysis, are there any questions about just the general kind of process or any of that part? Okay, thank you. With that, I'll hand it off to Caleb.
Thank you, Victor. My name is Caleb Levon. I'm a senior manager at CBiz Optimus. Prior to CBiz Optimus, I came over to CBiz to Optimus in 2022. Prior to that, I was the Medicaid forecaster for the state of Oregon for about 5 years. I'm an economist. I was asked to take a look at the assessment, forecast caseloads, and help propose an assessment analysis. So next slide. So got about half hour to 45 minutes. So feel free to jump in with questions as we go. I will walk through these various topics. We'll talk about the assessments, the expenditures, the assumptions that are built into that, some of the important factors in the forecast, what the rates would need to be in order to raise the appropriate amount of revenue. We'll sum it up with a final table that sort of shows all the numbers and talk about the impacts on the fund balance. So feel free to ask your questions as we go, but I'll go through this moderately quickly. The assessment rates have been unchanged for the past 6 years. So 2020 was, the rates were changed to $5.50 per member per month for the medical plan and 36 cents for the dental. And they haven't changed in that period. So they've been very, very steady. Next slide. Next slide, Don. So I don't like to bury the lead, so I'm going to tell back one. I'm going to tell you what the outcome is right at the start so you can see where we're going, and I'll explain how we get there. So we're going to recommend an increase in the medical assessment rate to $6.85 per member per month, and the standalone dental assessment rate up to 45 cents per member per month. And the reason that we're making that adjustment, we're proposing that you make that adjustment, is that the enrollment is forecasted to go down, but expenses are projected to increase moderately. And there are reserves currently, but we do not recommend spending all of those reserves down in 2026 during this fairly uncertain environment, I would say. So keeping those reserves will mitigate that risk and provide some additional investment income. So that's where we're going. Now I'll explain how we get there. Next slide. So the starting point for this analysis is, what are the expected expenses? And here we have the historical expenses for the last few years, and we have actuals. Technically, we have actuals up through May of 2025, but we have the up to 24 actuals, and then for the last couple of years are forecasted expenditures. So there's the marketplace expenditures, but also their shared service costs. So the total expenditures is the amount that the assessment needs to cover in order to be revenue neutral. So that expenditure is expected to be a bit over 9 million this year. And actually, I'm going to take a step back and remind everybody that the marketplace operates on a calendar year, not a fiscal year. And I get it. We've been using state fiscal years for everything, but the marketplace operates on the calendar year. So these are calendar year numbers, and thus they may not line up with fiscal year numbers that you see. But for calendar year 2025, the marketplace expenditures are expected to be a little over 9 million, and then a little over 10 million in 2026. So those expenditures are going up, and I would say not extravagantly, but moderately. And there's reasons for that, but I'm not going to get sidetracked. Chicky can, if you have questions about where those expenditures are coming from, Chicky can speak to that. But the expenditures are going up moderately. So that's the first piece of the puzzle. We got to cover these expenditures. And then the question is, how much does the assessment need to be to cover these expenditures? So we'll go on to the next slide. So in order to get to the revenue that the assessment would raise, the next step is to calculate what the enrollment we expect in calendar year 2026. So we need to forecast an effectuated medical plan enrollment. And our starting point is we create a baseline forecast using that recent history. If you want to dive into the technical details, it's a seasonal exponential smoothing model that uses the last up through May, 3.5 years of data to create that baseline model. And that model sort of assumes that things continue along their current trend, the trend that we've seen over the last few years, plus a seasonal adjustment. So that's your baseline. Now we need to add impacts for known factors that are going to impact that enrollment. And we identified two in particular that we model, and that is the end of the enhanced premium tax credits. So those are additional premium support provided by the feds. And I'll talk about that more in a moment. I'll talk about each of these in more detail in a moment. And then the second point is the impact of the OHP bridge. Bringing those extra people onto Medicaid obviously impacts the marketplace. The forecast itself does not include impacts that might arise from the possible 2025 Marketplace Program Integrity and Affordability Proposed Rule. So that's a federal rule that's being discussed, has not yet been approved. And obviously the federal budget reconciliation, which is in the middle of that political fight to determine where that lands. So it doesn't include those factors, this forecast. And we're aware of them. We understand their risks, that they have every possibility of having sort of secondary impacts that would impact the marketplace, but we don't know which way they're going to go, and we can't anticipate the impact that they would have, the actual magnitude of the impact that they would have. So given that, let's first talk about the enhanced premium tax credits. The next slide. Oh, I'm sorry, jumped the gun. So I mentioned two things that weren't included. There's actually a laundry list of things that are not included. These are all sort of known risks, but we don't necessarily know which way they're going to go or if they're going to happen or what their magnitude. There's lots of reasons that we can't include them. Typically, we forecast with the sort of current legislative policies. So we try not to forecast things that are that haven't happened, that aren't that we don't know will happen. So it's possible that they'll end automatic re-enrollment. That could have a significant impact on the marketplace if people do not get automatically re-enrolled. There's the potential that the provisional eligibility for advanced premium tax credits goes away. Obviously, there's the possibility that the premium tax credits go, here we call them advanced premium, but the expanded premium tax credits go away. Or they might not. It's possible that they get renewed. At this point, it's not certain. There's obviously a lot of movement on Medicaid, the federal level. They've certainly talked about shortening the open enrollment period, which has a noticeable impact on enrollment. Overall, there's, uncertainty and volatility on the policies and procedures impacting the marketplace. There's other federal administrative choices that they could make that, that could impact calendar year 26. And at the bottom, economists always include, we could have a recession. I don't even think most people would be surprised if we had a recession in the next couple of years. And that might impact the number of people that sign up. And that can be more complicated than you might think because the marketplace sort of sits in between Medicaid and employee or employer provided plan or provided insurance. And so the recession can move people off employer plans, but it might move them all the way down to Medicaid, or it can move people that were in the marketplace down to Medicaid. It's tough to know exactly what that impact would be, but the recession is always a risk. Okay, so now we're going to talk about the expanded premium tax credits on the next slide. So currently, under the current legislative posture, these the end of the Inflation Reduction Act will mean that the enhanced premium tax credits go away. And those premium tax credits reduce the cost of the premiums substantially for some, particularly for some people. So it would imply that some of the premiums for plans get more expensive for some people. And it can be from a little to a lot, but it can be a moderate amount. Our analysis estimates that this would result in a decrease of a little under 4,000 in enrollment, and that would take place on January 1 of 2026. So we can get into more of those details if people want to discuss it, but in a nutshell, this isn't as large as we thought it might be, primarily because people are not surprisingly what we would say inelastic to the price, meaning people need health insurance sort of regardless of the price. Now, there's some prices and some people that just can't afford it. But generally, just in a general sense, if the price goes up, people just have to swallow those costs. So, and that, obviously that's unfortunate, but it means that the impact here is noticeable. 4,000 is not nothing, but it is not a bulk of the people. It's not even a particularly large chunk of the current enrollment, which is currently around 130,000, roughly. So that's the impact of the enhanced premium tax credit. So we take the baseline forecast and we show a decrease in that forecast of 3,800 starting in January 1 of 2026. Next slide. The larger impact, the one that is more impactful, is the OHP bridge. And so, as you're aware, that makes people with incomes between 138% and 200% of the federal poverty line eligible for OHP. Now, there was a transition plan that went into effect, and people have already been moving into that category, into that plan, as early as July 2024, although we assume that more of those people are taking that up really this year. There is a policy or a process question about when people that are on the marketplace but are eligible for the bridge plan make that move. And currently, there's not a requirement that forces them to go into the bridge plan. And so we see people with incomes in that range that are staying on the marketplace currently. And so those are the numbers we use. We looked at the number of people in that poverty range, in that income range, and we tried to estimate when they would move over to the OHP bridge plan. So our analysis suggests that about 11,000 people could potentially move in 2025. And we are already substantially into 2025. We use data up through May. So May was the last data we used. And so we presume that some of those people have already moved out of that 11,000. Some of them have already moved into the marketplace, and some may move throughout the year, onto the end of the year, over to the OHP bridge. Now, we are trying to estimate the rate for calendar year 2026, and these are calendar years to be clear. So we estimate there's an additional 7,500 that would move over in 2026. And that would not be everybody that's currently in the marketplace that has that income in that income range, but it would be the bulk of them. We would assume there might still be additional people that come over later, and that there's some we think, relatively small subset of people that would still remain eligible for the marketplace under certain asset rules. Anyway, there are some technicalities where there might be some small amount of people that in that income bracket that would still stay in the marketplace because they would not be eligible for the bridge. So these are the numbers that we applied to the baseline forecast to account for the OHP bridge. And in this case, we did a linear estimate, and I'm honestly not sure that's necessarily the best way. It is not clear exactly when people will move over. They might move over in chunks. They might move over gradually. There might be some mix of those two. So we just fit linearly, said 11,000 over that first year in 2020, over this year in 2025, and then another 7,500 over 2026, and just kind of fit them linearly in there. And so the enrollment goes down by a certain amount each month based on this. Okay, so then that has the impact. Next slide, please. Here's your graph. So this is meant to show that impact in a visual form. So on your left is enrollment, right? We're roughly bouncing between 120 and 140,000 there in our recent history. Along the bottom is the timeline. This graph goes back to January 2021. I've got it forecast out to January 2028, but that's not germane for this particular analysis. The period of interest is calendar year 2026. That's highlighted in green. The blue line is the actual medical enrollment that we have data for. So you see that goes out to May of 2025. And then the green line is the forecast, starting with the baseline, minusing the impacts of the expanded premium tax credits and the OHP bridge. Causes a decrease. Without those two things, the forecast was relatively stable. I mean, it still had the seasonal pattern to it, but it was relatively level. But the impacts of those two factors do push the forecast down moderately. So we see in calendar year 2026 that the forecast is expected to be about 114,000, just a little more than 114,000. So that's an important number. That's our average enrollment, and that's what we're going to use to estimate the appropriate assessment. We're going to multiply that assessment by the number of months times that enrollment per month. Okay. Questions so far about this part of the analysis, the forecast and medical plan enrollment? Okay. Next slide, please. So there are a few other pieces that I need to include in the analysis to get to the final analysis. One thing we need to know is what the premiums are, and that doesn't impact the assessment directly, but there's a requirement that the assessment not be, that any assessments not sum to more than 5% of the premiums. So that's in particular why we have the average medical premiums in here. We're not near that cap, so we're fine, but just want to show what the premiums have been doing in the last recent years. You see this staircase, stair steps going up. And lately it's been, 6 or 7 or 8% lately. So it's been pretty high premium increases year to year. Next slide. I mentioned that we not only have to account for the medical enrollment, but also the standalone dental. And standalone dental is a much smaller piece of the total. The assessment is smaller, the number of people in the plan is smaller, so it has a much smaller impact on the revenue raised. Here you can see it's a very seasonal pattern. The sawtooth is people enroll at the start of the year in January and then fall off over the course of the year. We assumed that the dental enrollment would have the same relative decreases as the medical enrollment. So not the same amount, but the same relative amount. So it decreases by the same sort of percentages as the medical enrollment. And we estimate there'd be about 26,700 people in calendar year 2026, the average of that declining enrollment. Okay, and then next would be, we'll see dental premiums on the next slide. Dental premiums have been steadier, so they're growing less strongly and there's less movement, but you see it is on an upward path. We forecast that to continue. So we assume that dental premiums during this calendar year will be $38.26 for what that's worth. All right. So now we get to the revenue that's required on the next slide. So if you'll remember, the total expenditures on that second table that we saw for calendar year 2026 was a little over 10 million. That was the expenditures. Now, given the dental enrollment that I just showed, the forecasted dental enrollment, and assuming, this is assuming an assessment of 45 cents per member per month, we would raise $139,000 in dental assessment revenue. I said this was a small piece of the puzzle, but we just need to account for it. But we would raise almost $140,000 in dental assessment revenue. The other source of income for the marketplace is the investment income from the current funds. There's a fund balance right now, a little over 10 million, a bit over 10 million. And so there's an investment income that comes from that. And so I used the lowest of the recent returns by quarter. So it's a conservative, I would characterize this as a conservative estimate. And it's roughly 4.5%, but it is based on recent investment income, kind of using a conservative estimate that's 573,000 investment income. So we subtract those two other revenue sources from the 10.1 million and we arrive at roughly 9.4 million. And that's the revenue that we need to raise using the medical assessments to be in equilibrium. So the next slide. So it turns out that that number, that equilibrium assessment rate is $6.85. So I'll just explain this table because you probably haven't, if you weren't here last year or previous years, you probably haven't seen a table like this. But what this is across, so each of those columns in the middle is assuming a different assessment rate. And then each of the rows is assuming a different forecast. And the middle forecast, where it says forecast equals 114,061, that's our current, that's the forecast. That's our current forecast. But if we end up having 5,000 people more than that, then the row above that shows the revenue that would be raised at each of those assessment rates that are in the columns. If we had 5,000 people less than that, then we would raise less revenue. You move down to the row below and you can see the revenue. The set of dollar figures on the far right is the equilibrium rate that would raise the necessary revenue given that forecast level. So at 114,061, it's $6.85 is the assessment rate that would raise the necessary revenue. And if you look at the table in the middle, right in the middle row, in the middle column, it's 9.4 million. So that's how much revenue would be raised by a $6.85 assessment. If the forecast ends up being, 5,000 low, we'd only raise 9 million with that assessment rate. If the forecast is 5,000 high, we'd raise 9.8 million with that assessment rate. And then you can see in different columns what the equivalent revenue that would be raised. So 9.4 million is the revenue we assume that is necessary to cover the assessment. So that's the bottom line. There's some details that a few minor details that I'll talk about next, but that is really, you've seen sort of what I told you what the number was, and then I sort of showed you we needed to know what the expenditures were, and then we looked at the forecast, and now we've timed the forecast enrollment times the assessment rate times the number of months, and then we get the revenue. And so in order to cover those expenditures in calendar year 26, we need $6.85 worth of revenue. So I'm going to pause there, take a breath. Questions at this point? Okay. Next, the next slide I mentioned, there's sort of a cap on how much assessments you can raise. So the next cap, or the next slide, I'm sorry, the next slide discusses current state of that. We go to federal exchange technology charges. So it was mentioned earlier that there's a separate assessment that goes to healthcare.gov that cover their expenditures. And so that's a separate assessment that's paid directly to the federal government. It had been about 1.8% for a while, but then in 2024, for calendar year 2025, it went down to 1.2%. And then this year, it went back up to 2%. That assumes that the expanded premium tax credits are not extended. So assuming the Inflation Reduction Act, the legislation that it contains the expanded premium tax credit extension expires, if that expires and the expanded premium tax credits go away, then the federal technology charge will be 2%. So the current state assessment of 550 is roughly 0.8% of the average premium. At 685, that represents about 0.94% of the average premium. And I mentioned there's a sort of a cap on the federal exchange assessment and the state assessment cannot be more than 5% of the premiums. So that's why we do some of this math just to check this, and it turns out we're well below that. You can see that here it's 2% plus, roughly 1% is 3%. So we're still, even with these adjustments, we're still well below it. Okay, so those are all the pieces. Now I'm going to show you the big table, and you don't have to digest this all at once, but it has all the numbers and details on it. If we go to the summary slide now. And there's a lot of data, so I apologize if it's kind of small, but this is more something that you can look at your leisure if you're interested in tracking how these things have changed over time. The columns are the calendar years, and the last column is 2026. The enrollment has been in the 30s. It went down slightly in 2025, but then it goes up every year during open enrollment, and these are sort of averages during that time period. So the current enrollment can be higher than these averages, if that makes sense. We show the total premiums and what the average premium is, assessment rates, the federal technology charge, and then the dental, and then we do is run through a similar thing for the dental plans, and then at the bottom is the combined amount. And that really gives you a sense of all of these pieces and how they fit together. So the total assessment, if you go down the column 2026, the last column with the dashed lines, and you go all the way down to the bottom table where it's combined, the second line, total assessments, 9.51. That's the revenue raised from the medical premiums and the revenue plus the revenue raised from the dental premiums. So that's where that number is, and we've talked about that amount, 9.4 plus the 1.4 or 140,000 plus the 9.4 million. So hopefully that ties all of that together. That all makes sense. The last piece of this puzzle is the fund balance, and that's, yeah, it looks like Stacy, yeah.
I'm sorry, on that prior slide, I just want to make sure I'm understanding the
Mhm.
percentage of increase. I'm just looking at the medical, because the percentage of change says 5%. Do I add the 5 and the 2% for the federal tech and it's 7%? Or is that 2% included in the 5? I'm just having a hard time understanding.
Yeah, sorry, no, you're talking about,
Just the percentage of change of the current rate proposed to the new assessment. Is that a 5% increase or is it 7?
so there's a 5% increase in average premiums.
Yeah.
Am I?
Well,
Yeah,
yeah.
yeah, so that's just the premium amount.
That has nothing to do with the assessment. That's just
It doesn't have to
right.
do with the assessment
Okay.
change.
Mhm.
Yeah, yeah.
Okay. Thank you.
Mm-hmm. Okay. Any other questions? Last piece is the fund balance. So this can be more complicated, or it has in the past, because there was sort of a requirement that that the fund balance can be above a certain percentage of your sort of operating revenue, and then the excess had to be refunded back to the carriers. But that is no longer true. They got changed in a previous legislative cycle. So now the fund balance is really just your expenditures, your revenue minus your expenditures is sort of the change from year to year in the fund balance. And you see the fund balance has been creeping up. And we set the assessment so that the fund balance would stay constant for calendar year 2026. So, and these are I'm sorry, I didn't say this earlier. These are the numbers at the end of the calendar year. So December 31st of each of these calendar years. So the fund balance at the end of 2026 is going to be the same as the fund balance at the start, within 3,000 or whatever, 2,000. And so that was a deliberate choice to allow the flexibility to cover risks, whether they're those federal risks, Medicaid risks, standing up, all of the risks associated with the marketplace, which is very volatile right now. It's a lot of balls in the air, and we don't necessarily know if they're all going to get caught or handled well. So we believe it's probably prudent to keep that fund balance available. If the forecast is particularly low, we'll still have those we'll still have that revenue I'm sorry, if the actual enrollment ends up being below the forecasted enrollment, then we'll still have those funds to help cover the expenditures of the market of running the state marketplace. That's what I have. Is there questions? You can go on to the last slide, but I'm happy to answer any questions or go back to any slides people might have, or questions about slides people might have. Okay, well, if more questions arise, let me know. Otherwise, I'm gonna hand it back. Thank you.
I actually see a hand up. Sorry, I just wanted to check if that was a question for the prior topic or if that was for.
Yeah, this is Bo writes with Providence Health Plan. I had a question about slide 28 with the total revenue. Is that the revenue with the current it is current assessment rate? Would we know what that would be with the new proposed one?
No, so this fund balance is assuming that you make these assessment changes.
Oh, okay, that is what the new
Yeah,
one.
sorry,
Okay.
sorry. Yeah.
Thanks.
Yeah, I guess I meant current assessment for each of those years, but I understand the confusion.
I see.
Sorry.
Thank you.
Yeah.
Okay, not seeing any other hands. Hi all, apologies for my lateness and thanks to Nishoba for stepping in earlier. I think we are on public comment. Is there anyone signed up for public comment at this stage? Or anyone on who would like to offer some? Letting the silence do the work. Okay, I'm not hearing any there. I think the next step slide is up after this. Victor, did you have anything to add here?
Yes, I think this was just kind of to address the next steps that will happen after this as we go into rulemaking. Again, after this advisory meeting, we would take the steps to file the hearing notice for the rule. We are going to try to do that before the end of the month. We're cutting a little close, but hopefully we can get our teams together and make that happen. And then after that notice of rulemaking, that notice will have a date in the coming months. So it'll be sometime in July when we'd actually hold the rule hearing, at which time we'll take a public comment based on the information we collect here today. We'll put those new rates as our proposed new rates, take public comment, and then after that hearing process is done, we'll be able to file the final rates sometime in August, assuming everything else goes fine or there aren't, any comments that make us sort of reconsider. And then that will be sort of the finalization of the rule. Before then, that will essentially be sort of our notice to carriers. That's what we intend to do. So that's again, barring anything else, there are some special extra steps that happen with an increase. We've not done an increase before. So in addition to filing that rule, there are other sign-offs we have to get before the effective date or in anticipation of the effective date, including presenting to the legislature and getting sign-off from the Department of Administrative Services. So there are extra steps involved that will kind of extend that timeline. So the filing of the rules doesn't automatically make this like written in stone. It'll be pending that sort of final approval from those entities. We don't anticipate any issues with that. Feel like our reasoning is sound. I did want to clarify too, when we were because some of this is done by rule, but that follows what's in our statutes. And in our statutes, it did previously have a cap on the amount of reserves or fund balance we could keep at a given time, with a requirement to refund back to carriers or do some kind of mechanism to give that money back. That was removed in the legislation that approved our project to become an SBM. We would anticipate that after implementation of the SBM and moving into maintenance on operations, once things sort of stabilized, they only removed that cap and in its place said that any excess monies were specifically for the expenditures for that project to make that project happen. So once that project is done, it's possible and likely that they would revise that and kind of revert it back to putting some kind of cap, as most agencies do have, where we just can't keep all the money we want in the bank, but that there would be a limit on that. So just wanted to clarify that. I don't know that that's permanent. I wouldn't expect it to be. We'll just have to see what the legislature wants to do once that's up and running. So with that, there were just a couple of things, because again, this is an increase and a little bit different. Some things I kind of wanted to run by the committee. I kind of wish now I had made up a couple of slides, but really they're just sort of conceptual. There are a couple of elements of the rule filing that ask us to provide a statement or information about what we anticipate the fiscal impact would be. Every other year we've done this since it hasn't changed. We said there's really not going to be a fiscal impact. But this year, because we're anticipating this increase and asking for this increase, what we estimated is that overall there would be a minimal impact, primarily to carriers, who are the ones that pay the assessment. But of course, carriers pay the assessment based on the rates they file for premiums on the insurance plans that Oregonians buy. So, so that there would also be a minimal impact to Oregonians, kind of explaining that really by the time you get to the individual premium level, the amount that people would see in an increase compared to regular premiums would be less than 0.2%, and that seems very low. Like it would be difficult to notice, and so we also anticipate that kind of a change would not disproportionately impact any particular demographics or populations, mostly because of that kind of in comparison to the average premium, it doesn't amount to something that would be noticed above like what just happens in ordinary rate increases from year to year for insurance plans. Addressing that, we know, even $1 is something that can be a big deal for really anyone, and that no amount is like a nothing amount when it comes to assessing what an impact might be. But in relative terms in this space, there wasn't anything to indicate that impact would necessarily, again, hit any specific populations or demographics in Oregon disproportionately. So with that in mind, those being our assumptions, I did want to run that by folks here and see if there were any kind of questions or different take or something else that we hadn't really considered when we're considering economic impacts to any populations, or that what I mentioned about disproportionate impacts. There is also an equity statement. That equity statement needs to now reflect what we anticipate changing because of this increase. Again, don't really see that affecting people on an individual level very much at all, but welcome to any input or thoughts about other thinking we may have about this. Stacy?
Yeah, Stacy's hand is up.
Just a couple questions, and this may not be the right forum for it, so feel free to educate me. But it's my second, I think, time seeing this, so still new. And last year, like you mentioned, there was no increase. So it was really easy to kind of really understand and follow and get on board with. This year, there's an increase. So I just have a few more questions. And it's really around the presentation made sense, the looking at the revenue needed, that all made sense to me. I was able to follow it. The part that I find myself pausing on is around the expenditures. As those are going up, I don't really understand why. And that, nothing to do with Caleb. That wasn't part of what he did. But I'm just wondering if there should be some transparency or view into what those expenditures are, why they're increasing, so we all feel comfortable to then say this makes sense. To me, it's you kind of have to look at both to really feel comfortable moving forward with the recommendation. And again, that may be nothing that the HIMAC does. I have no idea. So I'll pause and maybe let you respond to that question. And then I just had one other comment around the timing of the increase.
Sure, I may let or kind of see if Chicky wants to speak to that. I have a few thoughts on that about especially why that doesn't come across necessarily in the presentation because it is primarily focused on just the sort of a little more narrowly on the the bigger overall numbers, but what's behind that in terms of extra expenditures, we do have, of course, the preliminary cost of the SBM project that's kind of wrapped up in there because during the implementation year, we will have some costs associated with that. But before I get too deep into that, I wanted to see if Chicky had more details on that.
Yes, I'd be happy to. So this is Chicky Flowers, Director of the Oregon Health Insurance Marketplace, and I'm actually also going to tag Liz Mill here at some point as well. So Stacy, our budget process is as it follows the governor's requested budget as well as the legislatively approved budget process. So our budget for the 2026 plan year actually is part of House Bill 5025. And we'd be happy to send you all of all of our submissions in terms of what we're projecting in terms of our expenses. So a lot of our expense increases for 2026, a lot of it is salary benefits. There are cost of living adjustments in there as well, and some SBM costs like Victor mentioned. I'm sure there's more financial speak that I am not the best person to relay what that financial speak is. But Liz, if I miss any specific details in terms of the budget, so Liz Mill is our HPA Business Operations Budget and Technology Manager. She is part of the team that helps put together our budgets that go through the whole process of, so our agency submit our budgets to the governor's office and then that goes into the governor's approved budget, which then follows the legislatively approved budget process, which is still ongoing. And hopefully with Sunny Day happening next week or so, hopefully that will be approved fairly soon. So it is transparent in that way, but please let us know if you would like copies of those documents. We'd be happy to send those links. And we'll do a better job next time of tying those two things together. So thank you for that flag / feedback. Liz Mill, did I miss any specific details?
No, I think you covered it. Yeah, there's, our increased costs and just the payroll in general for cost of living and increases. We do have a couple additional positions for SBM in the POP and some additional money for advertising as well. So it's not too much, but those are the main things that are built in there.
Thank you for that. I think that addresses my questions, Cheeky and Liz and Victor. I appreciate that. My last comment is around, I'm going to say the timing of the increase. And again, I don't know, things are probably set the way they are, but this doesn't cause me a lot of angst because it is a nominal amount of additional increase to the existing premiums. But if it was a little more significant, carriers have already filed and approved their rates for 2026. So that burden does fall to the carrier. They can't adjust premiums. That's my understanding. So not for 2026, but they would maybe account for it in 2027. So I'm just wondering if there's a way to do this a little earlier in the year to coincide with rate filing or allow carriers the ability to adjust premiums if maybe it's a threshold or something of that nature. So I guess that's my comment, but I'll let you educate me on maybe why that doesn't work.
Sure, and I'm sure other folks would have more to say about this. This is highly out of the ordinary, this timing. We almost always do all this in first quarter of the calendar year, like right after open enrollment or kind of starting during open enrollment. And then when it was ending in January. Don't know if that'll be the case going forward, but that's actually part of the reason now this particular one is later in the year because there were so many different factors, including this program integrity rule, but even before that, because that didn't drop until springtime. But that kind of made next year's circumstances kind of iffy in terms of we had anticipated not changing the rate until next year, until for plan year 2027 to do the whole kit and caboodle for the SBM implementation. With things being what they are and the potential expiration of EPTCs, all of the different variables that we knew would likely make enrollment drop. And then at the same time, considering again, just some of those additional variables that were introduced right after that extended our timeline to kind of make sure that and thankfully we did, because if we hadn't kind of taken that extra time, we may have assessed a little too optimistically. And one thing we don't want to do is run out of money. So so that's but yes, this is definitely an anomaly and definitely not something that we would wish to continue to do on this timetable. And with our understanding of when the premium rates actually need to be filed, I know they don't get finalized until a certain point in the year, but in terms of initial filings, at least, and then the back and forths that have to happen with DFR, we prefer those to come again earlier in the year. So before I speak any more on that, wanted to see if Chicky had anything to add.
Yes, so we did consult with the Division of Financial Regulation when we were considering extending the timeline. We know preliminary rates were filed May 15th and goes through, I believe, August or September. So rates aren't fully final yet, and it can be rate changes may still occur. And we did flag for the carriers, I forget which industry communications meeting it was, but we did flag for them that this year is going to be an unusual year in terms of our timelines. So we did check in with various groups to make sure that this timeline worked. So we tried to sync up with everybody as well as CMS's timeline. They had various different rates depending on when EPTCs were going to be expired, or rather the decision to extend or expire. So there's a variety of different factors. This was a very challenging year, Stacy, to let you know, not just a timeline, just trying to figure out how to look into our crystal ball of how enrollment could look like with all the different changes that are happening that we may know today, and then we might, could completely change by next week. So please know this is definitely not our ideal timeline, but this is the best that we could do without cutting it too close to open enrollments. Also when rates are final, which I believe is happening in a couple of months.
Thanks for asking those questions, Stacy. Anyone else want to raise a question here? No. Or if your hand raising isn't working, you're a member, just hop off mute and give it a shot. Okay, Victor, were you going to say anything else on voting specifically here?
No, only that just as a final word, wanted to throw out there, we, for our staff, may consider, just throwing this out there for Chicky too, kind of packaging what Stacy was asking about in terms of our, what's changing cost-wise, kind of in a simpler format than we may have in like what we submit for the budget stuff for legislature. Just something a little more like a wrap-up or something condensed so that it's pretty obvious what we're talking about when we say these things went up. Because I've made my own way trying to wade through a lot of that stuff. And I feel like if we, especially on behalf of the committee, kind of did the work to condense those things, it might help looking at it a little easier.
Thanks, Victor. Chicky, was there anything you wanted to say here related to voting or anything else at this point?
The only thing related to voting would be logistics. So we'll do it our usual style of voting where instead of doing it by chat, though, I will. So again, please ask for a first motion and a second motion. And then if we do have a motion, and then I'll call out the name, and then we'll record your vote through video and audio, please.
Okay, and I apologize just because I wasn't here earlier. Have folks already confirmed quorum and we're good there?
We did have quorum at the beginning of the meeting. I think just looking at the virtual room, we still have quorum.
Okay, great. Apologies again. Me being gone is a tax that way on everyone, but thank you. Is there anyone willing to make a motion, as Chicky stated, and then I'd be looking for a second?
This is Ron Gallinet. I'd be happy to make a motion, and I assume it would be something like a move for approval of the 2026 Marketplace Assessment Analysis.
Thank you, Ron. Yes. Is there a second?
This is Paul Harmon. I can second.
Thank you, Paul. Appreciate it. Any discussion, other questions or comments? Okay, Chicky, I think it's to you for roll.
Okay. Gladys, how do you vote, please?
Approve.
Thank you, Stacy.
Approve.
Charles Fisher. Chair Lindsay Hopper.
I'm going to abstain given my absence. Thank you.
Shannon. Kathleen Orrick. Claire Pierce-Roble.
Approve.
Om Sakinai. Joanne Zumbrennen. If my math is correct, if I tracked everything, I feel like we got 7 approved votes and 1 abstained. Did I track that correctly?
I apologize that I was not counting along with for the numbers. And there was at least, I thought, one person who was here who was trying to come off mute and maybe couldn't. So I was a little bit focused there. Apologies, Chicky. Do you think we need to recall it, or is there a way to go back and look at the transcript?
I think.
What was Nishoba's vote?
Yeah, this is Nishoba. I move to approve.
Okay. I think that was the only vote that I didn't note, and I think we had everybody's vote.
Thanks, Don. What's the count then?
So we had 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, 6 for yes. 3 were not here, and 2 no, 4 weren't here, and you abstained.
Okay, so that puts us at 6 yeses, 1 abstain, and we have a few absences. So it looks like we do need to follow up with those that may not be here today to see if we can follow up through email, see if we can get a vote, because I think that's with 6 votes, that's not full quorum for approval.
Okay.
So quorum would be one thing, but then isn't it just simple majority after that, Chicky, for the vote, or does it require more?
I believe we need quorum.
Okay, so the issue is quorum, not the issue of majority yes who are present. Okay.
But let me verify that. Let me verify that with our rules, but at least we have documented at least that we have 6 yeses, 1 abstain, and then we have a couple of absences. Please, my apologies for not knowing those rules intimately as of right now, but we will verify that we will verify and follow up through email, and then also follow up with other attendees, especially our carrier partners, with the decision of the HIMAC after we have those legal citations or those rules.
Thanks, Chicky. Thanks, everyone. So next meeting, yeah, Stacy, that's what I was wondering, looking back, if there was quorum for that, and I apologize, I don't know. It sounded like maybe, and maybe we lost a few folks since then, perhaps. Okay. So thanks for the follow-up, Chicky, and maybe it will be already handled, but maybe there's more to come. Next meeting, July 17th, should be on the schedule with a hybrid option. This one is structured as Teams and then also HSB. So if the intent is to hold it over Teams, great. If the intent is Zoom, right now everything I see in the invite is Teams.
It'll be moved to Zoom. I just set up the Zoom meeting today, and I will be removing the Teams information and putting the information for Zoom in both the meetings for the rest of the year within the next week.
Great, thank you. Okay, so everyone disregard the team's business on there. I think with that, I think we're probably at the end. Chicky, or anyone else, is there anything else for the good of the order today?
Just for the HIMAC, please know that our next meeting is in July 17th in a couple of weeks. It looks like it's going to be quite a loaded agenda. If you haven't been following the news, while we were meeting, the program integrity rule, final program integrity rule from CMS just dropped. So the team and I will be working to provide a high-level overview on that, as well as your requested topics. For the July 17th meeting, there were requested topics regarding network adequacy / a rate filing process. So we've invited our DFR partners to that meeting. So we have quite the agenda, and it will be a hybrid meeting. Again, to what you said, Lindsay, it'll be both an HSB and a virtual option. It will be in Zoom, and we will update those calendar invites shortly.
Great. Well, thanks to the team for that meeting ahead. I appreciate everyone being here, and I hope you all have a good couple of weeks and a safe summer, and see you soon. Thank you.
Thank you.
Thanks all.